The clerk will read.
Assembly Bill 890 by Assemblymember Wood and others, enacting the Healing Arts.
Dr. Wood, you may open.
Thank you, Mr. Speaker and members. From late 2017 through 2018, I was a member of the California Healthcare Foundation's Future Healthcare Workforce Commission. During that year, I learned a lot about the challenges we face with our healthcare workforce in California. It confirmed a lot of what I've already known from my district, and we have significant challenges if we're going to provide healthcare for all Californians. We have a shortage of primary care providers in many rural and urban areas. A 2017 UCSF report estimates that by 2025, we will have a shortfall of 4,700 primary care providers in California and a need for roughly 4,100 more by 2030. All this to meet the expected demand by the population. Between 2008 and 2015, the number of primary care doctors in California dropped by 10%. At a time when the population grew by 2.4 million, clearly heading in the wrong direction. Like many of you, I've always supported additional funding for residency programs, loan forgiveness programs, which are great tools, but are costing tens of millions of dollars of every year, and will not get us to the point of meeting our workforce needs. We simply cannot buy our way out of the shortage of primary care providers. There is a tool that I have come to believe is needed in California, and that's reflected in AB 890, which would allow nationally accredited nurse practitioners with a minimum of 3 years additional real-life clinical experience and practice to provide services without the need for standardized protocols by physicians. These NPs would be required to pass a national licensure exam that assures competency. The exam would need to be validated by an entity within the Department of Consumer Affairs, and if not deemed sufficient, supplemental components for a California-specific exam would be developed and required. Amendments from Assembly Appropriations strengthen the clinical time before NPs could practice without protocols. Will California be breaking new ground with this bill? Actually not. In 22 other states, they do this already. At the Veterans Administration, they do this already. And in that not-so-rural area of the District of Columbia, they do this already. As currently written, the bill would be the strictest of any of these bills related to the scope of practice for nurse practitioners. There are countless studies that have shown NPs practice safely and competently without the oversight of a physician. But nonetheless, we've included additional time requirements in the bill to assure that only the most experienced NPs will be able to practice this way. No nurse practitioner right out of school would qualify under this bill. And I agree with that approach. I believe the bill strikes a reasonable balance between the need to provide more access to care and the need to maintain quality health care services. I believe this bill will help large urban as well as rural areas. Currently, 59% of nurse practitioners are providing primary care already, while only 17% of physicians do so. Nurse practitioners are more likely to accept Medi-Cal and Medicare than their physician counterparts. 90% of nurse practitioners will likely see Medi-Cal and Medicare patients compared to about 64% for their physician counterparts. These numbers and countless others from studies I've read shown that access is increased when supervision requirements are removed. Analysis of peer-reviewed research, and there is a lot of it, have concluded that NPs provide care of comparable quality as physicians, even with NPs practicing without physician service oversight. Patient satisfaction is high with nurse practitioners. Prior to introducing the bill, I met with opponents. I asked them for evidence to the contrary, and I've received none. What I have heard is anecdotal stories about the problems, but this is not peer-reviewed studies I would expect from the medical community. The bill is supported by a broad coalition, including California Association of Health Facilities, California School-Based Health Alliance, Essential Access Health, the Steinberg Institute, SEIU, AARP, RCRC, and at least 50 other organizations. I respectfully ask for your aye vote.
Thank you, Dr. Wood. Dr. Arambula, you're recognized.
Thank you, Mr. Speaker. You know, I want to start, if I can, by respecting our colleague and chair of health who has worked on this issue and continues to champion this issue. I must respectfully disagree with the current bill that is before us and would ask this body to spend a little more time being deliberative. Now, I would have personally appreciated an opportunity to have seen this in committee. Unfortunately, I was not here last year when this bill was heard in committee, and believe that in the second year we should have an opportunity to continue to work on this bill if it does not get off this floor today. Now, I want to recognize many of the nurse practitioners who I worked with, from Chrissy Paley to Jen Terrazon to Dennis Levine to Sandy and Brittany and Crystal, people who helped to expand our practice and were wonderful to work with. This is not an issue for me of quality and training. This is an issue of getting it right. And this version, to me, still has issues in its current form, whether it be with the lack of a corporate bar or ability to hire physicians at hospitals, which is not present in this bill. And I just would ask us to do what we say we do in medicine, which is to measure twice and cut once. This bill is not quite ready, in my opinion, and would request that this body allow us more time so that we can get it right in this upcoming year. Thank you, Mr. Speaker.
Thank you, Dr. Rambula. Mr. Lowe, you are recognized.
Thank you very much, Mr. Speaker and members. I rise to urge an aye vote. I rise to also thank the member from Healdsburg, our Assembly Health Chair, the Business and Professions Committee staff, myself, the author, and stakeholders have had a number of conversations, hours of conversation since inception. And in fact, I recall being in my district during a break last year to which Dr. Wood asked about my opinion on this area of topic, to which then he followed up the following month, and then the following week, and then the following day. So we have been in deep conversation with this issue since inception, as well as stakeholders alike and opposition. So I just wanted to clarify that for members, should there be any additional clarification required on saying if there's been exhaustive conversations on these issues. Certainly, as this bill hopefully moves forward, there'll be other opportunities on concurrence and otherwise for the appropriate policy committee in the Assembly to hear this again, to which I know that we'll also have feedback. But as we sit here today, just given our legislative timeline, I urge an aye vote.
Thank you, Mr. Lowe. Mr. Rivas, you are recognized.
Thank you, Mr. Speaker. And I rise as well in support of this bill. I'd like to thank our colleague from Santa Rosa, Healdsburg, whatever it may be, for his leadership on this issue and for authoring this bill. I want to thank his staff, who has worked for the better part of a year with all stakeholders in an effort to craft the best possible legislation that we have here this afternoon. And I am a proud supporter of this bill because it will directly impact, in a very positive and pronounced way, thousands of people in the district that I represent. And as I've mentioned in the past on this assembly floor and in personal conversations with many of you, I represent a relatively large district. Parts of 4 counties. It includes parts of the central coast of California. It's considered suburban, rural. And I represent tens of thousands of farm workers living in rural parts of California who struggle to find access to quality, affordable health care. Now, this bill will allow nurse practitioners to practice to the full extent of their training and abilities. Now, look, I served as a county supervisor for 8 years prior to my time here in the State Assembly. On the local level, the best policy ideas that I supported were those that we negotiated and refined over several months, and in most cases, it took several years. Now, my local government experience taught me that policy ideas refined over time with the involvement of all stakeholders led to the best possible outcomes, and that's the best possible outcomes for people. Now, the policy ideas forwarded by this bill Assembly Bill 890, are not new ideas. In fact, over 25 states already have done this exact same thing. The policy proposal before us today has been tried, it has been tested, and it has been proven to work. This policy idea has been discussed, it has been deliberated, the research is complete, we have the data before us. Californians need us to stand up and deliver on the promise to expand access to care. This policy will do just that, and it'll directly impact the farm workers and those living in underserved areas of the district I represent and in similar regions across our state. Assembly Bill 890 is good public policy, and it is the right thing for us to do. So I urge and I vote on this bill. Thank you, Mr. Speaker.
Thank you, Mr. Rivas. Dr. Eggman, you're recognized.
Thank you, Mr. Speaker. Members, I also rise in support of this bill. And I appreciate the conversation when we're saying this is going too fast, too fast. I can remember my very first year in office, 2013, as I was caring for my sister-in-law as she was dying, and she didn't have health care insurance, which was the reason that her cancer went undiagnosed until the last 2 months of her life when we finally were able to have it diagnosed. And I remember the conversation going on in the committee saying that that care wasn't good enough. And I remarked at the time, well, it certainly would have helped. Something would have helped. And the Affordable Care Act went into, she died in August of 2013, and the Affordable Care Act went into effect in January of 2014. Her life would have been different. It could have been potentially saved if she had access to health care. We know we've expanded health care to a lot more people now. This year up to 26 for those undocumented. Now we want to go even further for those seniors. But we need care providers. If we don't have care providers, then expanding access doesn't really mean anything. They're just words. 22 other states already do this. And before many of you were alive, 1965 is when the nurse practitioner profession went into effect. Time improved. As a combat Army medic, I work with plenty of them in the military, serving in the VA system and the military system, as well as with physicians assistant. We're not saying that nurse practitioners will take the place of physicians. We would never say that. But it's another option for primary care. And in rural areas where I also represent, but I also represent Stockton, California, which is a urban community with a high need of care, very high records of poverty, and very low numbers of providers. That's a recipe for disaster as we see HIV, tuberculosis, things like that going up. Some primary care, having more providers there to see folks at the front end will really help us improve our healthcare outcomes. So again, we've been talking about this for years. I think to say it's going too fast is a little disingenuous, and this is just the first house. So there's still a little bit more time to make sure everybody gets to the table as we continue this conversation about providing quality care and access to Californians.
Thank you, Dr. Eggman. Mr. Vopel, you're recognized.
Mr. Speaker, members, so I caution on this bill. I do not support it right now. It needs more work. It needs to come back to us next session. Here's why. I spent 39 years as an insurance expert, at least I thought I was an expert, designing health plans for large corporations. And here's the deal on this one. Nurse practitioners are noble and great, but they're also a way of saving money for large corporations and other health plans. If you funnel people off to nurse practitioners and avoid physicians who are in charge, then that is a cost saver. It is also providing inadequate service in some cases. So I caution this body in voting for this bill right now. I may support it in the future, but it needs work because this provides an outlet for lowering quality of care and saving money for various entities that we may not even know. Thank you, sir.
Thank you, Mr. Vopel. Ms. Petrie-Norris, you're recognized.
Thank you, Mr. Speaker. I rise today in support of AB 890. I think that the arguments in support of this policy are really quite compelling. As I've shared with the author, I do have some concerns about the creation of a new board and the structure and management as specified in the bill. And the author, I appreciate your assurances that you'll continue to work with advocates to refine that as this bill moves forward. But today I will be supporting this bill and look forward to working with you and to ensuring that we do continue to expand access to health care for all Californians. Thank you.
Mr. Jones Sawyer, you're recognized.
Thank you, Mr. Speaker. I rise today to speak on AB 890. I will be supporting this bill today to help this bill move forward. I do have some concerns that I would like to see addressed as the bill moves forward through the process. My community is currently an underserved community medically, and I believe that this bill will give it a chance to have some healthcare professionals. This bill does not guarantee that nurse practitioners will be serving my district or even rural district because it lacks a requirement that they do a minimum time of service in underserved communities. I am also concerned that this may lead to a divided healthcare system where those that can afford it go to the doctor, while those that cannot afford it go to nurse practitioners. The people in my district utilize Medi-Cal at a high rate, especially undocumented youth, a system that is currently underserved by physicians. And I do want to make sure that that when this bill moves forward, we don't forget to keep working on ways to get more physicians in districts that look like mine. We need more healthcare professionals, period. I believe that this bill provides a better opportunity for my constituents than the status quo. This bill does not solve all of the healthcare access problems and still needs to continue to be fleshed out. I will be voting for this bill today, but reserve my right to change my vote when this bill returns to the floor. Members, I respectfully ask for your aye vote.
Thank you, Mr. Jones Sawyer. Dr. Quirk.
Yes, I rise in support of AB 890. I would like to say that physicians often run into situations that they can't service, and they send them on to specialists. I have full faith that an experienced nurse professional who runs into a situation that she doesn't feel competent to serve can ask for help then. I think that's quite adequate. Again, this is a very tough bill, tougher than other states. Other states have not had a problem with this. I strongly urge an aye vote.
Thank you, Dr. Quirk. Seeing no other members seeking recognition on the item, Dr. Wood, you may close.
Thank you, Mr. Speaker, and thank you, members, for your comments, and I appreciate them very much. You know, I didn't come to this easily. In 2015, as a freshman legislator, this bill came to us, or a bill similar to came when I sat on B&P, and I didn't vote for it. I didn't vote for it because I wasn't convinced. And I spent more time in my district. And then I went through the Workforce Commission, and I spent more time in my district. And I became absolutely convinced that this tool will help us provide additional care for people in my community and also in communities like a member from Los Angeles and others. I don't believe it potentially funnels people off anywhere. I go back to the fact that this bill as is already stricter than it is in 22 other states. I'm not sure that means, I think it's ready to move on. If 22 other states can do this safely, provide high quality care for patients, with a lesser restrictive bill, I'm not sure why this one shouldn't proceed forward. The idea that we might want to ask practitioners to guarantee they would serve in an underserved area for a period of time, I would say that if we're going to do that, we're going to force people to guarantee them, we should be doing that with all healthcare providers and not just nurse practitioners. And that might not taste so good to some people. But the reality is we need to get care to people who need it the most. Some have said this will provide 2 tiers of care. I say we already have 2 tiers of care. People who get care and people who don't get care. And my goal is to try to get more care to more people who need it so that they don't have to go to an emergency room, so they don't have to stress out our system, so they don't have to cost the system more. We know that when people don't have a medical home, they wait until longer and their conditions get much worse. And what do? They end up in emergency rooms. I desperately want to change that. I believe this is not the total solution, but is a tool in the toolbox, and I hope we can move forward. I will continue to work with the opposition on this. I always have, and I look forward to your aye vote. Thank you very much for your consideration.
Thank you, Dr. Wood. And with that, clerk will open the roll. All members vote who desire to vote. Okay. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll, tie the vote. Ayes 56, noes 1. That measure passes.